Hi, good morning, Joanie. How are you?
I'm doing good. How are you?
Good, good. It's a Sunday evening or afternoon for you over there. So working
Yes.
on your day off.
Is there ever day offs though?
No, for us, I think no, there isn't.
Yeah,
But I can really
exactly. Of
appreciate you joining us. So
course.
that's great. But thank you for joining us on your Sunday. But anyway, welcome everyone. My name is Nancy Abdu. I'm from the Australian Dermal Laser Institute, and I'm thrilled to be joined today by one of the most respected educators in electrology worldwide. It's an honor to have you here with us today, Joanie Gonella. Sure, she's an internationally recognized electrologist educator who's trained thousands of people and practitioners around the globe. So, thank you, Joanie. If you want to give us a little bit more of your background, you know you better than me. So, I'd love you to take it away.
Yeah, sure. I'm actually born in Canada, immigrated to the US. And actually, how I got into electrology was because my mom was an electrologist and esthetician from the time she was about 16. And so I got into it as a backup to university, but I it just drew me back, you know. There was something about this field that just has, something about it. And so I came back into it. I've been doing electrology since actually I went to school when I was 16. So it's been a long time. So I've been doing this for over 20 years now. And I'm just aging myself, but it is what it is. So I've been in this for quite a while. And honestly, I've been lucky in that I've been able to meet so many people and do so many different facets of this field. I own a practice with a lot of I think we're seven electrologists. I have a school. I've done work with Doctor International, working with the Apple's technology, which, as you know, is number one in the world. And so I've traveled the world to be able to teach this technology and work with different distributors. And so, I mean, that's kind of what's bringing us here today. So it's been great, honestly.
That's so good.
Happy to
And
be
I
here.
love that it's not you're just an educator and that's it. It's, you've got the hands on too. And I think that makes an educator really special. And they can speak from the heart and from experience. It's not just, you've learnt the textbook and you're out there and you're teaching. It's you're actually living it, you're breathing it, you're doing it. So, when you go and educate, it's real life, isn't it?
It is. It is. Everything I teach about, I have experienced in some way, and the rest, I've always been very. You ask my mom, she'll tell everybody. I was once upon a time I was studying to go to medical school, so I was an aspiring doctor at some point. Obviously shifted gears, but I still very much like science and medicine, and so there's a lot about the theoretical aspect of electrology
Yeah.
that if you hear me speak, you know that I'm pretty scientific in my talks. I think that it's kind of important to understand, the nitty-gritty of anything. But yeah, I mean, everything that I talk about, I've done, I've experienced to a certain extent. So
That's super important. So I love that. But look, I have a series of questions here for you.
let's do it.
So let's see what can come of all these amazing answers that you'll be offering. But first of all, the first question I've got is, you've taught a lot of people, like you said, all around the world internationally. So from your perspective, what skills or knowledge do practitioners often realize that they're missing until they've shown, oh, you show them another way or a better way.
And I think that there's no shame there. I think that people just don't know what they don't know.
Yeah.
And so there's a lot that has to be taught. And sometimes, and I know that, some people are pretty good about seeking alternative ways to learn, but sometimes you just don't know what you don't know. And so it takes a lot to go out there and find somebody that's going to teach you things that really wasn't part of your initial training. There's no shame there. I mean, I own a school and I train electrologists, and even in a licensed state, I know how much can really be taught in a certain amount of time, and there is a lot to this. There's a lot of nuance. It's difficult, and I know this. So there's no shame, in not really being up to par. I think that the first step is realizing that there's something missing
Yeah.
and seeking it out. I think that's so important. An open mind really to learning is just so important. Um, so, theory prepares you. I think it's great. People can find theory online. There's books that you can buy, and there's a lot of that. But really, the hands-on mastery is what transforms you. You really need to be able to see how other people position, how other people do insertions, and what depth they're really inserting at. And just being able to talk to everybody else and share is huge, honestly. So, common blind spots, following the skin instead of the follicle. So looking at the hair from the outside and trying to assume, like, oh, that's the way it grows, as opposed to trying to imagine the follicle in 3D. Using too much or too little probe diameter. Being inconsistent with the tension or how you're stretching the skin. I mean, these little things, like sometimes people are not taught that there's actually a way you should stretch the skin that is optimal to insertion. Timing. So current timing based on habit, always doing the same thing. So you're setting your machine to the same time and intensity, no matter what you're working on, where there's a lot of nuance to that. Or just thinking that anytime there's a stubborn hair, it's just, increase the machine, increase the intensity as opposed to changing your technique. So there's a lot of things that are there that I think that people don't really realize is just technique and being able to just tweak a little something, and it's very small in order to really take it up to the next level. So I think that that's kind of huge. I mean, expert guidance really like helps a lot. Just sometimes there's things that I noticed in people working that is, again, very, very small. Move your hand just this way, just this little bit this way. Go in a little bit deeper, move a little bit faster for this, or a little bit slower for this. And it makes a huge difference in their technique. Something just kind of clicks. So it helps a lot to have other people kind of coming in and sharing in those moments for sure.
And I think, on your own, when you're in the clinic, especially for those who are solo, electrologists, and you're not able to bounce ideas or
Of
have a
course
look at
not.
how
Yeah.
that person's, delivering their treatment. It's a very isolated business. It can be an isolated business, and so I think having guidance from someone, like yourself is going to be really pivotal, and not pivotal, important to that end result, right? So I think all these things that you're saying is actually spot on. And there's
I
no
always
shame
kind of
in like you said, no shame in actually going, oh, I
There
think
is no
that's
shame. I
right.
always kind of explain to students, it's like, because I said in the beginning, my mom's been an electrologist for over 40 years.
Yeah.
And so don't think that I have been exempt from the, corrections here. Like I've learned just like everybody else along the way. And my mom would be the first one to be like, oh, you poked me, you tweezed that, you did this, you did that, And so it's good to have kind of these checks and balances, honestly. It keeps you in check. It's important sometimes to check your ego, especially if you're in a place where maybe you're the only one in your neighbor, your town, or you're quote unquote the best in the area. It's really important to sometimes just make sure that you're brought back to making sure that you're delivering the best work that you can. And sometimes it takes a little bit of outside influence to come in
I
and
agree.
bring that reality back for
I
sure.
agree. We're going to sort of like pivot to a different topic here. And so electrolysis, we know, can be life-changing for all genders, of course, and for many clients. So how can electrologists elevate their approach to make treatments more inclusive and affirming, especially for transgender clients, or for those who are undergoing gender affirming care?
I think it's important to understand that electrolysis for a lot of individuals is not just cosmetic,
Yeah.
it's life-changing and it's medically necessary. And so our approach really has to reflect that. It's not a huge shift, I think, for most electrologists. We already understand the type of life change that we make in people's care. So you already know. You've done a few clients, you know what it's like to change people's lives just by removing facial hair. So it's not a huge stretch here. I think that sometimes what gender affirming care means is that you have to just understand the population that you're going to be working with. And that sometimes mean, using affirmative language, using correct pronouns, avoiding assumptions about anatomy and experience and surgeries. Because you've read somewhere that, that somebody that is transitioning does these types of surgeries doesn't mean that everybody does. And so you have to be careful with that kind of stuff. And that really just comes with education with that population.
Yeah.
So one of the big talks that I'll be doing at the ABIC conference is going to be on gender affirming care, where I'll talk about pre and post care, the different types of surgeries. So I think it's important to understand pre and post care, pre-op and post-op guidelines, because we do the electrolysis preparing for gender affirming care surgeries.
Yeah.
So you need to understand what that entails. Positioning to reduce vulnerability and pain, we're working with very sensitive areas. And so just understanding what that specifically means as far as how we change the way we do things is going to be huge. Offering, predictable session structures to reduce anxiety. So people that are going in for sensitive work, genital areas, that sort of thing, it's already stressful enough.
Yeah.
So how are we going to approach the session and make this as comfortable as we can, especially taking into account the type of specific trauma that might be attributed to the specific population? And then, things like respectful draping for genital work. So there's little finicky things that we can kind of incorporate in how we work that can really help with that type of work. Hands-on experience definitely can change everything. Sometimes people, it's not, hair is hair, and I've always felt that way. So it doesn't matter where it is or who it grows on. You've
Absolutely.
been trained to do it, but sometimes I feel like there's just a block because you don't want to do bad work or to mess up. And
Mm.
so I feel like a lot of people, if they just have some hands-on experience dealing with maybe some transgender clients, especially like at the workshops that we'll be doing,
Yeah.
that's going to be huge because you kind of just break through the ice. And then after that, you'll realize hair is just hair. What have I been scared about, right? I can do this, no problem. So you learn some of the skills, you've done a little bit of the work, and then after that, you're good to go. So, I mean, recognize that you and me as electrologists play a really profound role in gender affirming care, especially for surgical preparation. We're really necessary. And I've seen this when I was at US Path. I know that Australia, there's Auth Path. And I hope that they're going to be at the conference, but there's we play a huge role in the gender affirming care, um, I guess, multidisciplinary envelope that happens with this. They have their therapists, their surgeons, their endocrinologists, their primary cares, but electrologists, I mean, we spend hours upon hours with these patients. And so what we do is really important. And I think that we have to kind of put, the training has to be there for sure, but recognize just how important we are and, put the emphasis on that it deserves for sure.
Yeah, I was speaking to a transgender woman who you'll meet, Peta Friend, and she was saying that when she goes to a clinic, the first time she went to a clinic, and it's about the facial hair, that's
Hmm.
the first person she actually ever reached out to. It wasn't a doctor, it wasn't
No.
an
Hmm.
endocrinologist, it wasn't anybody or anything else. It was actually an electrologist, because that's the first thing they tend to want to
Yeah.
remove, which is this, the visual. And
Yes.
so she was saying that she had to teach her electrologist what she can and can't say, or what's wrong, or what's offending, and the
Yes.
education should be the other way around,
Exactly.
rather than that
Exactly.
person who's going through the transition actually educating
I mean,
the
it's great on
therapist.
her that she was willing to do that. I know that for some people, like the tolerance level, it might not be there.
Yeah,
You don't want to be caught unawares. I think that it's not too complicated, but there needs to be a certain amount of awareness and education,
yeah. And that's what
to
I
that
hope
goes
that we
into
can
that.
bring. Yeah, I know that you'll be bringing a lot of that at the ABIC symposium, and also at our masterclass too.
And
So
I'm just a like a taster into this. There's a lot more that could be learned about it. But yeah, I can definitely crack the door open a little bit.
which I'm loving and cannot wait for that. So day 2 for the masterclass, which is different from the symposium, will be our actual focus for
Yes.
transgender
And
affirming.
that's the hands-on.
Yay! Yeah, so it's going to be great. Thank you. That's great. Thank you so much. Um, all right, well, let's go to, since we're talking about hormones, let's talk about conditions such as PCOS or menopause, or the clients who are undergoing, hormone therapy. What deeper understanding tends to make the biggest difference to treatment outcomes in these particular cases?
I mean, and I've already said that, like, we already know hair for the most part,
Yeah.
but what we need to understand is the hormones
Yeah.
behind how the hairs grow, don't grow, and things like that. I mean, hormone literacy really just changes how we treat things. So we have to understand androgen sensitivity, insulin resistance, thyroid function, and how estrogen influences follicular activity. And that way we can stop being surprised with unexpected growth.
Yeah.
So we always kind of talk about, electrolysis takes this long and then you're going to be done forever. And the most part, it does follow that. But if somebody has something like PCOS and hormonal hair growth, that time frame might be a little bit different. And we have to be able to be transparent and honest with the client. So sometimes, some of the biggest differences in treatment outcomes just come from like understanding how some follicles respond faster than others. Why is it that certain areas will be quick to be done and other areas just fight you to the death? And how hormone therapy can trigger temporary decreases. So somebody that has PCOS gets on maybe something like spironolactone, and then it helps to control the androgen levels in their systems, and all of a sudden, there's a decrease in hair growth. But what if they get off spironolactone? So there's lots of different things that can happen where hormones will start to fluctuate, and you need to understand that, not to the level of endocrinologist, obviously, but to the level that how it affects hair. I think that that's where it's definitely within our scope, and it's something that we need to understand. Understand why PCOS growth can be progressive without like medical management. What if somebody comes in, says they have or they think they have PCOS, but is not being seen by a physician? What does that mean for their treatment plan and their hair growth? And really, also, this kind of all comes to what realistic timelines look like for patients like this. So, somebody comes in with PCOS, whether it's under medical care or not, what does that mean for how long is this going to take, right? It's usually going to be facial hair. So, how long will it take for you to clear my face? Well, you have to understand the variables that go into treatment planning, and especially how those affected by hormonal imbalances will change that treatment plan. So, you have to read patterns for individual hairs and individual clients so that you can help to just predict outcomes, plan clearances, manage their expectations also.
Big one.
Everybody has access to Reddit and other forums where they get their education on what you do.
Mm.
So you need to make sure that you're able to explain what they read and why it might not apply to them.
So true.
So, yeah, I mean, it's empathy, but it's knowledge. So, you feel for them, but at the same time, you understand what's going on here. And so you just really need to be realistic, and transparent. I think transparency is very
Yep.
important when it comes to what we do, just to make sure that they get, the best results that they can.
I think that's important, the transparency and setting the expectation. And if you don't know, there's nothing, again, no shame in saying, look, I'm not too sure about this. Let's put you in touch with a hormone specialist or an endocrinologist,
Mm-hmm.
or go speak to your doctor and get a referral. So, I've had instances where I've had to do that when, I didn't know the answer, or there's this influx in regrowth. And I've just said, look, I think we should, refer you on. Nothing wrong with that. You look more credible.
Yes.
I think it serves multiple purposes. It just brings up that credibility too, and the trust. So,
Yeah,
yeah, really
totally agree.
important. Really important. Um, all right. So what else do we have here? I've got, like I said, this list I'm going through. Um, Advanced electrolysis. So many people actually underestimate the how much advanced electrolysis relies on nuance, like you just mentioned. So the whether it's the insertion angle, the timing, current application, probe choice. The stretch of the skin, like you said. What kinds of refinements do you see transforming practitioners' confidence the fastest? Or is there actually any one thing?
Well, electrolysis is a microcraft. It's so finite, it's so detailed. It's very much a manual skill. Um, I have a hard time with people that try to learn how to do what I do off of watching YouTube videos. It's difficult. And I tell students this when they come in for orientation the first day. I say, um, it's a lot harder than you think.
Yeah.
And so, and I'm transparent about this too, because I don't want them to think or get frustrated. When you start, I don't want you to be mad at yourself because it doesn't click like this. It's okay. It's a manual skill. It's like learning anything else that is manual. You're going to just have to work. It's muscle memory. You're just going to have to repeat, 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 practice, practice, practice. That's just how that works. But, the small things that are actually huge when it comes to what the insertion is going to be just subtle little angle shifts. And I can't even explain it it's hard to see. Like I can see it when somebody's working. It's like, you're like this, I need you to be like this. And I barely moved. And that will make all the difference between now you can get the hair before you couldn't get it. Wrist rotation versus arm movement. So how you're holding and moving the probe holder is it's all a science. I see different ways that people hold the probe holder in the tools, but the way that we teach, everybody starts to learn the same way. And there's a reason for that. You can deviate with time and kind of adapt it to be your own. But it's kind of like you learn to ride a bike and everybody learns to sit and pedal the same way. Eventually, maybe you'll stand on the seat and pedal in your head. I don't know, but that's advanced. In the beginning, everybody learns the same way so that everybody can kind of just get the basics there. Um, how we pick probe size precisely to the follicle diameter plus hair diameter plus the depth that we're assuming it's at, and also the stage that it might be in and the technique that we're choosing. And so there's so many micro decisions that go into everything that we do, that it's not just black and white. Pick a probe, stick it in, and then zap, zap, zap up until the hair's dead. Sure, you could do that, but then don't be surprised if there's scarring left afterwards.
Mm.
So what we do, as Stephanie and I will often refer to, and Stephanie Shields, she does Electrolysis Unplug with me. So if you catch that podcast, you're on there, you've heard us before. But we talk about controlled trauma a lot. So the trauma that we cause is on purpose. We're trying to destroy the cells responsible for hair growth, but it's controlled because we're trying to keep it to a certain area and that area only, so that we don't destroy any of the tissues surrounding the follicle, the epidermis, or anything like that, so that we don't cause any kind of irreparable damage to the skin itself, right? So there's just so many little adjustments, microsecond timing adjustments, just going up a third of a thousandth of a second, and all these different things, that these little decisions that we make, that's kind of where the craft comes into play. So it's more complicated than people think.
Yeah.
And it's okay not to be there, but it also means that there's growth that can happen from that, right?
Yep, definitely. Wow. Okay. So what I'm hearing is it's not any one thing. It's a multitude of things, but it comes down.
Otherwise, it'd be easy, wouldn't it? If I just said, like, the only thing you need to fix is this, why would you need all of these master classes if that was the case,
True.
right?
Yeah. And the thing is that there aren't all of these masterclasses. So this is where I think our masterclass with you is going to be, very important. Um, I mean, and I'll be transparent. I don't deliver electrolysis training. I'm not a master at it. So
Mhm.
I deliver IPL, I deliver laser, but really not anyone can pick it up. Otherwise, I would have done it. But yeah,
Yeah.
time, practice, and I think just that hands-on and learning off,
Yes.
master electrologist is really where it's at.
There's this book I read a long time ago, and it's like I've heard it kind of denounced at the same time, but it stuck with me anyway, and I think that it's pertinent here. But it was called Outliers, and it was about like people that were extraordinary at things that they did. And one of the things that it talked about was just how many hours, or like what does it mean to be really extraordinary? It's something like a pro or like really like the top of your field. And one thing that it had talked about was that it took about 10,000 hours of you working in whatever it is. It really didn't matter. If you wanted to be a painter, it's 10,000 hours of painting. And so with electrolysis, if you're thinking about like to really truly be somebody that is like at the top of your field, you're talking about 10,000 hours of practice.
Yeah.
And when I think about my students, when they're done with their 600-hour program, because we're a licensed state here in California,
Mm.
they get 200 hours. That's the requirement. So it's a 600-hour program, but the practice itself is 200 hours. And so when they're frustrated at the end of their 600-hour program and they've done 200 hours of practice, and I say, to really truly be like an expert at your field, if let's say the number is 10,000 hours, you've got 200 right now. Would you say that it's the time right now to say like, I give up, I'm not ready? It's like, no, it's consistency, it's curiosity, and it's discipline. You have to keep striving for more. You just have to keep going because you're not quite there yet, and that's okay, but it's going to take time and you have to be okay with that too.
I think that's what we need to remember, just to be kind to ourselves and
Hmm.
be, like you said, persistent and consistent. And that can be
Yes,
challenging, like for a lot of
it
people,
is.
the
Yeah.
consistency. But yeah. Anything else you wanted to add to that? Or I think there's a bit there.
There's
Yeah.
a lot there. Yeah. Um, Yeah, no, I think that kind of, just remember that like being good is just knowing, what you're doing, knowing the rules, knowing the theory, but like being exceptional is really truly mastering your craft.
Yeah.
So I think that just takes time and it takes effort. I realize that, but at the same time, it's, I think it's attainable.
Yeah.
So anybody can really get there.
Yeah. Well, you've already answered my next question, which was, what makes a good therapist, separates them from an exceptional one. So that's that you've already answered that. So thank you for being ahead. Oh, well done.
No
What
problem.
about, let's go to devices. So you've worked with a number of devices, is that right?
Yes, I mean, for the most part, I've worked with mainly the Apple's machines. In the school, we do have some Instantrons, so it's Instantronic now is the company. Um, and so, but I've mainly worked with different versions of the Apple's. And so when I started, I had what was considered it's a discontinued machine now, but it's called an SX 500, and then I went up to a platinum, but one thing in California, so we're the local distributor here for like most of the US, and also we repair all the machines. And so a lot of the machines that come in for repairs end up in my office because I'll test them post repair to make sure that everything's operating correctly. So there's really not one version of the machines that I have not worked with.
Wow.
So
Okay.
honestly, like I know them all.
Okay. This is so then really you could honestly then give us a comparison. Like what sets the Apollos apart then?
I think that the Apple's is honestly, it's a world apart because of its precision in waveform and timing. And that really creates precision and results. And so you're talking like the computer component that Dectro put into their Apple's machines, so the electrolysis machines, and the consistency in the power output makes the machines not only state of the art, but extremely reliable. And
Wow.
that was big. And so you're talking about machines that can operate in thousands of a second. Not many machines were able to do that. They were the first to do the 27 megahertz waveform.
Yeah.
And that was back in 2005.
That's 20 years
So
ago.
exactly. And so, you're talking about a company that has an R&D, so research and development branch that has done research with Université Laval to do like, and is published in dermatology journals. So what they do in the field of electrology is always striving to be, like at the forefront of innovation. And so I think that that means that, people that invest in that type of technology, you tend to have what's best and newest and most up to date out there.
Hmm. Love that. And so, we're very fortunate in Australia, the Australian Dermal Laser Institute, or TADLI, we're now the exclusive distributors of Apolis or Dectro. And that's very reassuring to also know that we then also will be able to support our customers, and that warranty that they offer an extended warranty.
Yes.
I think is actually quite helpful, because if there's going to be a breakdown, it's going to be minimal. There's not many breakdowns that occur. Is that right?
Yeah, no, I mean, for the
Is that
most part, they're reliable machines.
Yeah. And so I think that gives me confidence. That'll give the end user confidence when they purchase this device, an Apple's device, that it's robust and it won't be something that'll break down. Not only that, the technology, like you said, the 27 megahertz is something that's quite still unique. I think there might be one or two other devices out there, but nonetheless, this is Dectro pioneered that 27 megahertz.
Yes, they
Love
sure
it.
did.
And what is this is not one that we discussed earlier, but pain. Let's talk about client comfort and the 27 megahertz while I've got you.
So, yes, I mean, on the market, when you're talking about sensation from the electrology, especially, we're usually going to be, in this case with the Apolis, we're going to be specifically talking about the thermolysis modalities. And the reason why the sensation differs across the different machines is going to be because of the frequency that the machine operates under. So there's a couple of different frequencies that are set aside for the use of industrial, medical, and I forget what the third field is, but they're going to be frequencies that are set aside for the purposes of what we do. And those are, if you look at the center of the peak, it's 13.56, 27.12. There's one that's down lower, you're at like 6.78 megahertz. So all of these frequencies are usually going to be the frequencies where most of the machines that you buy are going to operate under when it comes to the thermolysis. Well, there's a certain effect that happens in the skin and at the probe level when we operate a machine in thermolysis at each of these frequencies. One thing that I'll be talking about at this seminar is going to be how these modalities kind of differ. Um, and so we'll go into a little bit more about it, but pretty much what it means is that when we use thermolysis, we're coagulating tissues. And how fast that coagulation happens, and like coagulating, like think of cooking, if that term doesn't quite resonate too well, but how fast I end up cooking the tissue is very much dependent on the frequency of the machine.
Mm.
And so when you're talking about alternating current, we're talking about a current that oscillates from positive to negative. And in thermolysis specifically, because it's AC current, it happens at the tip of my probe. So my probe changes polarity, goes positive, negative, positive, negative. Um, and how fast this change happens from positive to negative depends on how fast the waveform goes. And when you have a machine that is 13.56, like let's say the senior 3G, the junior 3G, 13.56 megahertz means that there is 13,560,000 oscillations per second. So my probe can change from positive to negative 13 million times in 1 second. So it's really fast.
Yeah.
But what if I go 27? Then I'm talking about 27,120,000 times. So now my probe, actually, it's twice as fast. So I kind of use this analogy, and I don't know how cold your winters get in Australia, but think about the coldest place you've ever been, right? And your hands are frozen and you're trying to warm them up. And so if I have a machine that is at, let's say, 6.78 megahertz, and I'm trying to warm up my hands, it's the equivalent of me rubbing them together like this. Yes, I'm creating heat. Yes, through friction, right? Which is essentially what thermolysis does. But I'll be at this for quite a while. Now, what if I have 13.56? Now I'm going a little bit faster, right? Heat's created faster, friction is more. What if I have 27? Now I'm going like this.
Yeah.
And so the heat that I'm creating is just so much faster because that frequency is so much higher. So what that means is that I need less time
Mm.
and less power to create the same amount of heat in the follicle. Well, time and intensity is really what that sensation is. That's where the people feel things. And so the more time I need, the more intensity I need, the more it's going to hurt. That's really all that is. So a machine that has a lower frequency needs more time and intensity. Therefore, it's going to be more painful. There's
Yeah.
also more collateral damage, and there's different things that we can get into, and I can talk about this forever. But I go to 13, that time shrinks, that intensity can go down because I don't need as much. And then 27, it's even less. And so somebody that goes higher frequencies will tend to need less power and less intensity and less time to create the same amount of destruction as lower frequencies. Now, don't get me wrong, I can make all machines painful, right? All of these machines, they have the power in them. You can make them completely manual. Sometimes you have clients that are like, I don't like presets. I want to do what I want to do. You still can. I'll show you how to do that. No problem. I'll show you where to plug in whatever numbers you want to plug in. We'll make sure that you're not, overdoing things. So you can learn how to read energy levels and all this to make sure that you're staying within normal parameters.
Yeah.
But I mean, that's one of the great things. There's presets, makes it easy. But you want to do manual? We can do that too. No problem.
Before I move on to the next question, and then we're going to have to wrap it up, because of the time. So, what happens to the pain receptor? Because the time is so minimal. So, the pain
Well,
receptor.
they barely glimpse it, right? By the time the zap's done, your body's like, wait, what just happened?
Yeah, exactly.
Oh, ouch.
Yeah. So,
So
that's,
yeah, the
that's,
more time, the more your body has, your nerves have time to register what's going on. And so the more painful it ends up being.
oh, I love that. Love that. Because I know when I did my brows, I did them many, many years ago with the Sterics, and Sterics had its place, still probably does, right? Um, it I thought I was getting burnt every time because of the heat.
Sure.
But with the Apolis, I was like, oh, okay, that's it. So we were able to get through more of the hairs,
Yes.
and with so much more comfort. But
That's a big thing that I've noticed for people that go from like older technologies or different technologies to Apple's is that as far as your work is concerned, you're going to be able to sell your clients not only longer sessions, but they're going to be okay with adding new areas
mm,
because it doesn't hurt as much. And
yeah,
so they might be okay to put up with the pain because the facial hair is such an issue that like I don't care how much it hurts, get it off. But they're not going to do their underarms because
yeah,
that they can just shave that. What's the
exactly.
point? But once things don't hurt as much, once things are tolerable, they'll be like, you know what? Let's do my underarms. Let's do my Brazilian. Let's do my legs. And so the client that would have only been just the chin client and gone away now is a full body client.
Love that.
The
And
client
it
that
doesn't
books
take as
15
long.
now books 30 an hour. Yeah. And
Yeah,
so I think that in the end, everybody wins, right? They're hair free, you make more money.
win-win. So win-win is true. That's a true. So with the electrolysis masterclass that we've got here happening in January, when I say here in Sydney, what are you hoping they'll actually learn from you the most? So yeah,
I hope that we have enough of different cases that the people that come in, whatever it is that is your hang up, whatever it is that you're stuck on or your questions are, I hope, no shame. Use this opportunity to just come and try, like come in ready to work, come in ready to sit, have me hover over your shoulder, be open-minded. You can always ignore me when you go back home. I won't be there in your
I don't think
office,
so.
but just try to see how much you can soak up while you're there. Not just from me, but from other electrologists throughout Australia.
Mm.
I think that connecting together is so important. And
Yeah.
so you can meet other colleagues from across the like different states across the country. And sometimes it's people that you'll stay in touch with. I think that there's a lot to learn just from everybody that's there. So just coming with an open mind, coming ready to just, work and try different things, get outside of your comfort zone. If you've never done a bikini or, a trans woman's face or whatever it is, and we have these cases there, this is your opportunity. So take advantage of it.
Amazing. And it's going to be a small, intimate group. So the whole,
So
um,
everybody
you know,
can work.
everyone will be able to get an opportunity to actually, perform treatments. We've
Yes,
only got 8 beds, and to each bed, it's either 1 to 2 people who will be doing the treatment. So it won't be a group of 4 or
perfect.
5 per bed. So I think it'll be a highly educational and learning environment. Um, I think it'll be great, and having you to oversee it all will be just next level. I think it'll help, therapists elevate their game and just know how to, do particular, like you said, bodies and areas and have that extra bit of confidence. I think that's so important. So
Yes,
I'll be watching. I
agreed.
can't wait to meet you face to face.
Yes,
Before
same.
we go, can you give yourself a bit of a plug? Where do people find you?
So if you're interested in some of our home studies, if you go to electrologycoalition.com, on there we have a lot of home study courses, different webinars. We're going to soon announce our 2026 live webinars. I know that with Australia time, it's not going to be too conducive, but well, we record everything.
Yeah,
So for that, that's pretty simple. Also, Electrolysis Unplugged podcast. It's on all the different streaming platforms. If you're one of those that would like to kind of join us live and see the videos, then we do mentorship hour, which is the live recorded version of that podcast. And so, that's a membership, and we'd love to have kind of people on there. Submit your questions. Honestly, we build episodes around viewer questions.
love that.
So that's the gold right there. So just join, submit your questions, and then, hopefully we can kind of see where this goes. But yeah,
Dominate the electrology world together. Yeah,
that's right.
amazing. Thank you so much for your time, especially like I said, on your day off. So I really appreciate that. Very
Thank you.
informative. I mean, this is just a quick summary of,
Yeah.
what some of the topics we'll be covering. So imagine when it's live and you're there and you're actually there for, well, it's going to be 4 days really. So 2 days with the
Hmm.
ABIC symposium, 2 days with our masterclass. So jam-packed information.
Yes.
Cannot wait. Thank you so much.
All right. We'll see you soon.
Enjoy the rest of your day, Joanie. Thank you everyone
Thank
for
you.
watching. All right, take care.
Bye.
Bye.